Hi, everybody. I'm Phil Marshall with Conversa Health, and I'm your last 10 minutes of energy before your lunch. Now, we all know that 2018 is going to be a great year for digital health and health transformers, but it personally has a lot of relevance to me. If all goes as planned, I will turn 50 this year. And it also marks 20 years, almost to the month, that I started my health technology career. Now, I want to take you back 20 years ago. 20 years ago, almost to the day, is when Bill Clinton uttered his most famous of words, "I did not have sexual relations with that woman, Miss Lewinsky." Now think about that. The most dangerous thing coming out of the White House at that time was fellatio. Now for me, it was a really important time because I had just jettisoned a career in general surgery to pursue my passion for what the internet could represent in healthcare. I gave up a career that was going to be stable, reliable, and lucrative in order to pursue this passion I had because I felt like the internet was going to disrupt that power differential between providers and patients, help patients become more equal partners in their care. Now, how do I go about this? Well, I started in Portland, Oregon, which is where I did my surgery residency. I worked with Kaiser Permanente and the Center for Health Research. They had just gotten done with implementing the first large system on a new EHR called Epic. And so I decided to study the physician attitudes about that. And what I found, and published this, was that they found that EHRs can impact their workflow. They're worried about that screen getting in between them and their patients. Now, not a lot has changed on that front the last 20 years. And so I published that. It wasn't entirely favorable, and I needed a job. Epic, of course, would have been the perfect place to go, but I had just published an unfavorable study, so I shot myself in the foot. There was no way I was going to be able to work with them, but there was another EHR company called Medical Logic in Portland. They were about ready to merge with Medscape. They were about ready to have an IPO, and they offered me a job. I needed a job. I wasn't able to pay anything more than interest on my medical school loans, and I turned them down. What was I thinking? Well, if you were inside my head at the time, what you might have heard was, well, EHRs are really just a data foundation. There are a lot more patients than doctors, so go with the numbers. And if you could create an awesome application that helps patients gather, store, manage, and share their own health information, and maybe use a taxonomy, so all those clinical codes, maybe even claims codes, you can roll up and target that with personalized content and personalized tools. You could help the patient make better treatment, provider, and benefit decisions, and employers and payers would love that because their beneficiaries are more informed, and patients would love it because it's personalized. Everybody wins. I shared that with a few people that had started a startup called WellMed in Portland. They're like, yeah, we get that. We can't pay you anything, but why don't you come work with us? And so I said, okay. And so we actually grew that business. Turns out, employers and payers really did like that idea, and we sold that company to WebMD in 2002. And I'm thinking, this health startup thing's easy. I'm one for one. WebMD is just about ready to start offering my first legitimate paycheck in my entire career, and I said, I have another idea. I'm sorry, I quit. What was I thinking? Well, I was thinking genomic testing was really exploding. It wouldn't be awesome if you could offer pharmaceutical companies the ability to pair genomic testing with their drug and offer a platform to doctors where they could actually do the genetic testing and send those results back to doctors so they know the drugs they prescribe are going to be safe and effective for that patient. And patients know if it's safe and effective for them. And if patients could add their own phenotypic data to that genotypic data, pharma companies would love it if they could mine that data. Doctors are prescribing better drugs, patients are getting better drugs, and pharma loves it. Everybody wins. Turns out, pharmaceutical companies weren't too inclined to dump their entire business model on its head. Lesson learned, I'm now one for two. Okay. So, luckily, WebMD was willing to take me back. I laid low, kept my ideas to myself for a few years. And then Roger Holstein, the prior CEO of WebMD, asked me, he said, would you like to come and maybe run products at Press Ganey? And I said, Press Ganey, the print and mail patient satisfaction survey company. And he said, yeah. And I thought, well, Press Ganey doesn't have the hospitals in the US, and wouldn't it be awesome if you combine patient satisfaction data with clinical data? That'd be a great 360-degree view of care. And so payers would pay for it because providers would love it. Providers would love having that kind of insight into their care, and they need to anyway because of EBP, meaningful use, and PQRS. And so everybody wins. Turns out, patient satisfaction was really what Press Ganey did well. And they said, that's really what we need to stick with. Thank you very much. Could you please leave? And I said, all right. So I did, and they went on to have an IPO and then sell to a private equity company for a mint. So now I'm 1 for 3. Okay, so now I do need a job. I really do. At some point, you need to have some sort of income. So I am looking for jobs. I've got some decent experience, and then all of a sudden, I have another idea. And what I was thinking was, everybody has an iPhone now, and everybody likes to take videos, and look at kids today. They just love it. And so wouldn't it be great if you could actually create a collaborative video app? Let's call it Jumper Cut. That'd be fun. And people can actually create movie scenes, and then their friends could add takes into those, and then everybody around the world could actually sort those sequences and actually publish it in social media. It'd be incredibly powerful, very creative, and it'd be the next Instagram. Wouldn't that be awesome? Turns out that actually is still a really good idea, by the way. And I'm 1 for 4 at this point. The only solace I have is that the founders of YouTube thought the same thing, and they're still pursuing it. So, I wasn't necessarily completely off track on that. But now I'm 1 for 4. And I really do need to figure out how I'm going to make a living. But I'm down here in San Francisco, and I'm having lunch with my friend Wes Shell a few years ago. And I said, Wes, I've got an idea. And what I was thinking was, wouldn't it be awesome if we could create automated, personalized conversations between doctors and their patients? I mean, doctors need it anyway because they're going to value-based care, and they need to know how patients are doing between visits. I mean, you're not going to know unless you ask. Patients would love it because they're getting personalized conversations. You could bring in the EHR data. You could use a taxonomy foundation to roll that data up, and you could actually target those personalized content and conversations to people's profiles, both their comorbidities and their medications. And so patients are getting personalized experience. Doctors are getting patient-generated health data. They're improving their quality scores, and payers are able to pay for quality, and everybody wins. And he looks at me and he says, I love it. And so that's Conversa Health, and that's how we started that. Turns out, we hope, timing was reasonably right for that. I'm shooting for a track record of 2 out of 5 here on being a health transformer. But what this was all about is to try and impart on you, and especially you health transformers and those of you out there that want to be a health transformer, what would you take away from my career? And I've been struggling with this. I told the startup health folks, I said, what are they supposed to take away from that? That they're going to put their own financial future at complete risk and just double down on their idea no matter what it takes? I can't really advise that. I mean, do I advise them that they just talk really fast at everybody and just overwhelm them with your idea until they wear you down? That's not really great advice. And so I've been struggling with that. Well, yesterday on my way from SFO, there's a 22-year-old kid. He's trying to make his way to UC Davis. And so he asked me for some directions, like I would know. I'm from Portland, Oregon. What do I know? But I start talking with him. He's from Mexico. He's been in community college for a couple of years, but now he's at UC Davis. And I asked him, I said, well, what are you studying? He said, biology, but I really want to be a general surgeon. So here I am. I'm thinking, what am I going to tell you all about being a health transformer? But I had a more immediate task, and that was to try to share some insight with him that could help guide him in his career. And this is what I came up with. There is still no more fulfilling career than healthcare and medicine. Dedicate yourself to impacting as many people as possible in as positive a way as possible. Whether that's through surgery, whether it's through biopharma, whether it's through primary care, whether it's through technology. For me, I went from being a general surgeon, helping people one at a time, to what I hope will be helping millions of people one at a time through conversational AI. And as we look back in 20 years from now, 2038, hopefully, if all goes well, I'll be about ready to turn 70. I feel confident in a couple of things. I think conversational AI, of course, are going to play a big role in that next 20 years. I also can guarantee you that a lot of people in this room are going to make a big impact in that time. As for me, personally, I still have crazy ideas out there to pursue. I mean, I believe there will be flying cars. And the reason I believe there will be flying cars is because in 2001, I actually created a theory in physics called persistence. And that says that gravity and particle behavior are actually tied to the same thing. And that's the interplay of all particles that have ever or will ever exist in all of time, woven together in a three-dimensional fabric that when going around dense objects like planets actually create a differential pressure called gravity and cause the probabilistic behavior of particles. And if you can actually avert that differential pressure, then you could actually create anti-gravity technology, which could lead to an aerial revolution, which could probably lead to a socio-political revolution, which which might lead to a spiritual revolution and a psychological revolution as we realize that all things that ever were or ever will be are all tied together in one thing. Now, I'm going to pursue crazy ideas in my career, and what I will tell the other health transformers is continue to be real unstable geniuses out there, and I believe that in 20 years from now, in 2038, when we look back, we're going to be talking about you, and I think it's very unlikely we'll be talking about fellatio in the White House. Thank you.